According to the United Nations estimates, at least 15 million additional cases of intimate partner violence will occur due to the COVID-19 lockdowns. This is a rise of a silent global crisis during our COVID-19 pandemic. Let me tell you the story of Layla, a 26-year-old woman who found herself in more arguments with her husband. A husband whom she now had to spend every hour of her day with in their home in the Anhui province of eastern China. On March 1st, while Layla held her 11-month-old daughter, her husband began to beat her with a high chair. Slowly, as she started losing count of the number of hits, and eventually, while hovering to protect her child, she lost sensation of her leg and fell to the floor. A photograph that she took after the incident shows that the high chair was lying on the floor in pieces, with its two metal legs snapped off. This was evidence of the force that her husband had wielded against her. Another image documented that nearly every inch of Layla's lower legs were covered in bruises and that there was a massive hematoma blooming on her left calf. Layla, which her name will not be disclosed for her safety, said that her husband had abused her throughout their 6-year relationship, but that the COVID-19 outbreak made things far worse. During the pandemic, she said, we were unable to go outside. Our conflicts grew bigger and bigger, more and more frequent. Everything was exposed, she said. Today, 1 in 4 women like Layla worldwide experience intimate partner violence, whether it's physical, emotional, sexual, or psychological. Oftentimes, the abusers know where to tactically hit so it could be covered up the next day. But being in a situation like the COVID-19 pandemic, the perpetrators don't have to hold back anymore, as they have full control of the situation. Intimate partner violence is a gender-based issue, as 97% of the violence is perpetrated by men who have a female partner. Now you may ask, why is there a sudden rise of intimate partner violence during COVID-19? Isolation plays a significant factor in intimate partner violence. Currently, as workplaces are closed, visits to family and friends are discouraged, and even public parks have been made off limits. Social isolation has turned into a form of government sanction. Therefore, living in social isolation is the most common tactic employed by perpetrators of intimate partner violence. Isolation from friends, family, and any outside contact creates this perfect condition for the abusers to assert their control over the environment of the person that they will be abusing. Therefore, the perpetrators can turn this violence into this normalized routine, heightening the dependence of themselves to the person that they will be abusing and really feeding into the cycle of abuse. Stress is another important factor in intimate partner violence. Historically, when people are exposed to a constant state of worry, like a natural disaster such as a tsunami or an earthquake, there is a trigger, a surge of our stress hormone cortisol. Similarly, with the pandemic of COVID-19, we're dealing with a situation of an unknown end for its timeline. In fact, scientists reported that elevations in our stress hormone cortisol have long been associated with increased aggression. Now, both men and women experience tremendous amount of stress during COVID-19. However, not everyone demonstrates more aggression towards their partners. These elevations in stress may exacerbate pre-existing issues of aggression for male partners who have abused in the past. This is not universal, but it can occur. The closure of childcare facilities and schools adds to this level of stress within the home environment. The responsibility of watching children 24 hours a day only heightens an already stressful relationship. On top of all the other responsibilities for the parents, this additional parental supervision can lead perpetrators of violence to become even more aggressive in their homes. By association, the children are also in danger. In 2018-2019 child abuse and neglect reports, at least 1 in 7 children have experienced child abuse and/or neglect, and nearly 1,770 children have died of abuse and neglect in the United States alone. Not only do children suffer from being in an aggressive home short term, but also long term. one symptom being hypervigilance, a state described as a feeling on the edge with a tendency to react to a perceived threat. A distressing event can trigger a person with PTSD and make them feel as though they're physically under attack with the necessity to fight back. Such a reaction can happen for people who witness abuse, for example those growing up in violent families or neighborhoods. Therefore, isolation and stress are both contributing factors and worsen the situation for people that are already experiencing violence in their homes. Now you may ask, what about our resources? For example, court systems. Although most court systems remain open for emergency matters, such as granting restraining orders, many reports suggest that these processes have become delayed as many legal activists and lawyers have to now work remotely due to the COVID-19 lockdowns. On the other hand, let's look at shelters. While shelters typically serve as a safe haven for survivors seeking reprieve from abuse, they're now experiencing health concerns and closures due to their often dorm-like group living arrangements. So shelters do exist, but they're not effective in some areas. Now, let me walk you through some evidence that displays that women are currently suffering behind the scenes during COVID-19. Here in Canada, since the COVID-19 lockdowns, 82% of intimate partner violence survivors reported an increase in violent acts and their frequency. As the Canadian Women's Foundation reported, approximately every 6 days a woman in Canada is killed by her intimate partner. Despite the Canadian federal government announcing that it will double its emergency funding for organizations that are serving people experiencing gender-based violence, bringing the total to $100 million, there's so many women and children whose lives are not safe today. In Toronto, the Assaulted Women's Helpline receives approximately 4,000 calls per month. Yet last year, counselors reported picking up more than 55,000 calls between the months of March and September alone during COVID-19. Calls received at a Vancouver-based crisis line for women experiencing intimate partner violence jumped 300% over the 3 weeks in April. They were showing rates of 40% new callers. However, in other provinces like Saskatchewan and Ottawa, there have been drops of 10% to 23% in calls, respectively. However, just because the number of calls to these helplines have dropped in some regions, it doesn't mean that the violence is not happening. It suggests that the violence is being silenced. Now, what can we do to help these survivors of intimate partner violence? Let me walk you through some possible solutions. We can start by listening and believing the stories told by survivors of intimate partner violence. We need to create a safe space for them to feel that they're supported and that they can share their stories and be authentic themselves. Additionally, we need to make sure that not only are we training our healthcare professionals to watch out for signs of intimate partner violence, but also our school teachers, coaches, and community leaders. These should all be available with the tools that are actively there to help those that are in need. We can use this time as an opportunity to help survivors as community members by working alongside a larger framework, ensuring that both community members and governments at large are supporting survivors of intimate partner violence. Together, these two-pronged approaches can allow the growth of our community. Furthermore, we can ensure that we're building a sustainable support in our communities and encourage donations to charities that are helping these survivors of intimate partner violence. Governments and NGOs can help by providing different programs that can uplift survivors of intimate partner violence, creating a safe environment where these survivors can gain a higher quality of life statistic. We can invest in online applications for survivors of intimate partner violence, creating a virtual tool that gives them access to professionals like lawyers, career consultants, shelters, and psychologists without the knowledge of their abuser. Through social media, we can do calls to action, encouraging survivors to take the next step and seek help. Usually, Intimate partner violence survivors cannot leave due to psychological attachment or financial dependence to their partners, who behind the scenes are their abusers. Therefore, we need to make sure that our resources are accessible and well developed to encourage them to seek the next step and really get help. Empowering women to gain financial independence and establish a new life without attaching to their abuser. Another vital ingredient is having accurate data collecting measures. Governments and NGOs can prevent under-prioritization and underfunding in budget by ensuring that the scientists that they're using are presenting accurate data collection measures to combat intimate partner violence. The gathered gender statistic needs to be specific when we're talking about governance and making changes to policies. Using evidence-based advocacy, we can aid organizations in decision-making when allocating their budgets. Further, large companies can also place workshops and include information on resources to help survivors of intimate partner violence in their training manuals. This can not only be good for the large companies' public relations, but it can also help spread the word about the available resources in the community. Education is another significant factor. As a community, we need to deconstruct the negative narrative for those that are experiencing intimate partner violence. Intimate partner violence is not just this taboo topic, but it's a reality that people have to experience and live through every day. Therefore, we need to make sure that we're able to have conversations about it. Educating our youth about consent, teaching them about body autonomy, and taking accountability when a violent situation occurs. We can also empower our youth to advocate for women's rights and children's rights. We can provide educational workshops in our schools, community libraries, and workplaces, teaching people the signs of abuse and the available tools. To ensure that resources such as the Women's Shelter Canada are involved as part of the conversation. We need to support establishment of halfway houses and help centers in our communities. This way we can educate our community and show survivors of abuse that they're not alone and that they do have options and they can detach themselves from their perpetrators. So change is possible. Samna, a survivor of intimate partner violence from Toronto, Canada, explained that aside from the fact that her partner became so physically abusive to a point where she lost her child, he also accumulated a lot of debt in her name, maxing out not only his credit cards but also the ones under her name, and thereby completely ruining her credit score. When she finally did decide to leave him and tell the police what was happening, her life changed. She was then moved to a transition house where volunteers helped her get income support. Lawyers helped her gain custody of her second child, and other volunteers motivated her to gain the tools necessary to work towards a teaching career to support herself and her child. Ultimately, as a community, we can help uplift women like Sammy. We can acknowledge that intimate partner violence is a public health issue, an equality issue, social justice issue, and a humanitarian issue. As we have surpassed 2020, we have entered this new decade for action, where we can set up targeted goals for the following decade, 2030, to turn things around. Through vocalized solutions, governance, and new policies, we can create change. We can empower survivors of intimate partner violence to seek help and know that they're not alone. Henceforth, the voice of no woman or child should ever remain silenced. Thank you.